My name is Cheryl Hughes, and I'm the manager of the Histopathology lab here in the new lab in East Hanover, New Jersey. I'm going to show you where the specimens are dropped off by the courier every evening, and they bring them inside our laboratory in this hallway, and we have a lock box. The lock box is the box that we use that can be locked every evening, and they place the specimens in the box, and then we come in and we take them out. And here's the case that we just took out of our lockbox that was dropped off from the courier last night. When we check each case, it comes in its own individual bag with the patient's information on the paperwork and the specimens that they had collected. So we take out our paperwork and we check to make sure everything is here that we need, which is the requisition, patient's demographics form, and also the type of insurance that they have. And if everything looks good, then we take out our jars with the specimen samples that were collected from the patient's physician during their colonoscopy or endoscopy. And they usually label the jars 1 through however many that they have. So this one has 4 jars. And what we do is we look at the requisition. I've whited this out for confidentiality purposes, but we would check to see what the patient's name is, make sure all the jars are labeled with the patient's name, and then each jar should also be labeled with the type of tissue that's in there, should also match what is printed on the requisition. If everything matches, then we go to our VitalDX LIS system and we enter in all of the information that's on the requisition and everything that contains all the tissue samples that were collected for each separate container. Once all of the cases are accessioned, they all go into these individual divided trays. Each section represents one case and includes the patient's paperwork and the patient's tissue samples. I like to set the cassettes on top of the jars so that when I grab the first cassette labeled A and I grab the jar A, we know that this one belongs to this jar and cassette go together. So what we do is make sure it's labeled correctly, matches the cassette, and then we take our forceps, we take our tissue samples out. If they're really tiny, we use these little pieces of paper to put them in to make sure that we don't lose anything that's tiny, because the holes are sometimes small but not small enough. So we'll put our tissue samples on there, and then we can fold our paper. And then we set that sample of the tissue in the cassette. And we close the cassette, make sure that it doesn't come out, and we label how many pieces that we had in there on the side. Okay, so after all of the cases have been grossed, those white cassettes will come in here, they're put into a rack, and they're loaded onto this machine. What it does is it preserves the tissue to the point where it can be embedded into a wax solution. We have an automated tissue processor, and it takes about an hour and a half to do 110 cassettes at one time. So here's Jax at the embedding center, and she's going to explain to you how you embed the tissue specimens.
Okay, so when we're embedding, first we carefully open the cassette, take out the specimen, make sure that the specimen number matches on the side versus how many pieces are in the paper. And then each specimen is embedded in a wax mold, longest side down, so the doctors get the best cross-section view of each specimen. Once everything's been oriented, we put everything on the ice plate, and then once it's frozen, the blocks look like this.
And here's our microtomy room where we cut all of the patient's blocks. This is Janelle. She's going to show you a demonstration of how we actually cut blocks and make slides. Here's a ribbon being made, and the ribbon is placed on a lukewarm water bath. As you can see, the multiple different serial sections of the same tissue. And Janelle is taking what we call levels. We put 3 levels on a slide, which means each section that's on there is a little bit deeper than the one before it. Okay, once all of our slides are stained, here's Laura. She is putting the slides into the folders for our pathologists by cases. And each case is separated by a couple of spaces in between, and then our requisitions of each patient is put into each folder together. Okay, this is our pathologist who's now reading all of the cases that were from yesterday's procedures. And as you can see, she has the slides in front of her with the requisitions from each case. And she's looking at the slide under the microscope at the tissue section that was collected, so that she can make her diagnosis. So since the lab has grown in the last 9 years, we now have plenty of space to keep expanding with all the new technology and everything that's out there for histopathology, and to help serve better our patients and our physicians. The advantage of having an in-house pathologist here at GANJ is because they are able to read the slides the same day or next day. The turnaround time for those diagnoses for the GANJ patients is quicker and faster. And if there's anything additional that has to be ordered to help them with the diagnosis, it can be ordered quickly, and we're able to fulfill that request. At the end of the day, it's all about our patients.
With over 28 locations and 60 providers, we're your experts in gastrocare. Book your consultation today. Visit our website or call 1-888-452-0022.